Hi, I'm Jeff Infante. I'm Director of Drug Development at the Sarah Cannon Research Institute and a medical oncologist at Tennessee Oncology. One of the paradigms that's happening across all areas of oncology is understanding the molecular makeup of why cancer cells form and continue to grow. And if we can understand the processes that cause those change, then we can identify therapies that can target that. And melanoma has definitely been one of the tumors where that has made the most gains. The first was the understanding that about half the patients with metastatic melanoma or advanced melanoma have a abnormality or genetic change in the BRAF gene. Dating back into the mid-2000s, there was an abnormal gene that was identified in about half the patients with melanoma called the BRAF gene, which became mutated in about half the patients. And this gene is an oncogene, or causing cancer to grow. And quickly, compounds were able to be made that are able to target that abnormal gene, which makes abnormal proteins that wants the cancer to grow. So by targeting that particular gene, we're able to match a very specific therapy to an individual and have had dramatic results with patients. The ability to match patients to that one drug also has saved a lot of toxicity, because these therapies often don't have the same side effects that are associated with standard chemotherapies, and the outcomes have been markedly better. I think one of the big advances as we understand the genetic makeup of why cancer cells grow is as we develop very selective drugs to target it, people can tolerate these therapies better, and then they can stay on these therapies and their quality of life remains very good. So in melanoma, there's been an advent of drugs that target this BRAF mutation. There's also been other mutations that have been identified, including in the NRAS gene and GNAQ and GNA11. So as we're starting to understand the different things that can cause melanoma to grow, we can identify specific therapies to block those and help people do better. And their quality of life is also better, hopefully, because they can stay on these therapies with minimal side effects, or at least manageable side effects.